Hello everybody. First of all, my greetings to all on occasion of World Diabetes Day and National Children's Day, which is celebrated on 14th November every year. I will talk about World Diabetes Day, that is 14th November, and it is a birthday of Benty, who innovated and discovered insulin, and which has changed the life of millions of diabetics across the globe. Friends, the theme of World Diabetes Day 2022 is access to quality diabetes education, and I will like to focus on role of education in management of diabetes. First of all, diabetes is a combination of genetic risk and lifestyle factors. So, here comes the role of education in managing diabetes, because lifestyle plays an important role in management of type 2 diabetes. So, before I move ahead, there are two types of diabetes: type 1 diabetes and type 2 diabetes. Type 1 diabetes is usually seen in children, and these children, they lose the capacity to produce insulin naturally due to natural reasons, autoimmune reasons, and they require lifelong insulin for survival. Type 2 diabetes is common type of diabetes, and in type 2 diabetes it is a combination of genetic factors and lifestyle factors. So genetic factors, if one of your parent is having type 2 diabetes, the risk of you developing type 2 diabetes is close to around 30 to 40%, and if both of your parents are having type 2 diabetes, the risk of developing diabetes is around 40 to 50%. Now, what are the lifestyle factors which are responsible for development and progression of diabetes? So, first and foremost is the unhealthy diet. So, if you are consuming a diet which is rich in carbohydrates, which is rich in fats, and which is rich in calories, which is making you to put on weight, then you are more prone to develop type 2 diabetes. Or if you are already having type 2 diabetes, it may increase the risk of the progression and the complication of diabetes. So it is very important that if you are at risk of developing diabetes, that is if your age is more than 40 years, if you are having excess weight as compared to your height, if you have a family history of diabetes, if you are physically inactive, then you have to be cautious about your diet, and you have to cut down on your calories, you have to cut down on your refined carbohydrates, and you have to cut down on your fat in the diet. The second important component is regular physical exercise. If a person exercises regularly, then their insulin which is being produced in the body becomes more effective. So you can get more benefit of naturally produced insulin in your body if you are exercising regularly. So it will cut down the need for your medicines from outside, and it will also help you to lose and maintain a healthy weight. So what type of exercise are advocated for a person with type 2 diabetes or who is at risk of type 2 diabetes? So regular walking, or regular jogging, regular swimming, or regular cycling. So any aerobic exercise is advocated for prevention or management of type 2 diabetes. But a word of caution: if you are not exercising already, and if you are planning to start exercise, then you should consult your doctor first about your physical fitness to undergo any sort of exercise before you start any exercise. The third thing is you should monitor your blood glucose regularly, because if you are dieting regularly, exercising regularly, but if you are not monitoring your blood glucose regularly, you won't be able to know whether you are going in right direction or you need to change the direction. So it is very important that as per medical advice, you should regularly self monitoring your blood glucose or check your blood glucose in the laboratory periodically. And there is a test called HbA1c. HbA1c is a test which will give you an idea of average of the previous 3 months blood glucose in a single test. So it is very convenient also, and it is very informative also. So the guideline says that if you are having type 2 diabetes, you should check your HbA1c every 3 to 6 months, and you should also check other parameters like your kidney function, your cholesterol levels at least once in a year. You should also get your eyes, particularly the fundus, checked for changes of diabetic complication at least once in a year. So these are the lifestyle changes and monitoring needs which are required if you are having type 2 diabetes. Now equally important is medications. So lifestyle changes are important in management of type 2 diabetes, but they may not be sufficient alone to control your blood glucose in the desired range. So here comes the help of medications, and fortunately there are safe and effective medications available for management of type 2 diabetes, which you can consult your doctor which is the best medicine for you, and he is going to prescribe you the medicine which is appropriate to your condition. And if oral tablets are not effective in controlling your diabetes, then you may also require insulin injection to control your diabetes. So our goal should be that you should control your blood glucose very well with diet, exercise, oral medications or insulin, whatever is required. Our goal should be that your blood sugar should be controlled all the time and for a long time, so that you can live a normal and healthy life. So it is very much possible that by keeping your blood glucose controlled, so on an if I generalize, if you keep your HbA1c levels less than 7% over a long period of time, then chances of your developing diabetic complications like retinopathy, neuropathy or kidney problem or heart problem or stroke problem can be reduced or minimized or postponed or delayed. So that is very important. And equally important is type 2 diabetes is also associated with conditions like high blood pressure and high cholesterol. So if you are having type 2 diabetes, you should get yourself screened for presence of high blood pressure or high cholesterol. And if you are having high blood pressure or high cholesterol, it is very important that you get yourself treated for these conditions also, because type 2 diabetes along with hypertension and high cholesterol increases the risk of heart attack exponentially. So you have to manage all three conditions equally well. Manage your blood glucose to maintain your HbA1c below 7%, manage your blood pressure and manage your cholesterol to keep them in desirable range. Keep your weight in your appropriate range to according to your height, and you should consume a balanced and fiber rich diet so that your blood glucose remains controlled with a minimum medicine and over a long period of time. One of the common myths in children with type 1 diabetes is that they can be managed with oral tablets, because type 2 diabetes is very common. We see type 2 diabetic patients around us, and naturally we try to think that type 1 diabetes can also be managed with oral tablets. But as I mentioned earlier in my talk, type 1 diabetes is autoimmune condition, and it affects mainly children, and their body stops producing insulin due to autoimmune reason. So for their survival, it is very important that they are given lifelong insulin, because there is no substitute to insulin for these children to survive. And if they are not given insulin and or if their insulin is stopped, then they may develop a serious condition called diabetic ketoacidosis. Diabetic ketoacidosis is a condition where, due to lack of insulin in the body, type 1 diabetic children, they start producing ketone bodies, that is a form of acid in the blood, and this ketone bodies along with high blood sugar can cause vomiting, abdominal pain, and they can make the child drowsy and unconscious, and it can be a life threatening condition. So my message to parents with type 1 diabetic children is that on this World Diabetes Day, which is a birthday of Frederick Banting, who discovered the insulin, there is no substitute to insulin in management of type 1 diabetes. And if your child is having type 1 diabetes, please do not stop the insulin. It is required lifelong. There is one another complication which can be seen in both the type of diabetes, type 1 diabetes or type 2 diabetes, due to insulin or certain oral tablets, that is hypoglycemia. Hypoglycemia means low blood sugar, and low blood sugar means any blood sugar value less than 70 in a diabetic person who is taking oral tablet or insulin. So the symptoms of low blood sugars are very prominent, like sweating, palpitations, dizziness, headache, increased hunger, sudden onset of weakness, and sudden feeling of being unwell. So if you are diabetic or if your child is diabetic and if you are developing any of these symptoms, then simple remedy is you should eat a refined carbohydrate immediately. So you can take 2 to 3 spoon of oral glucose, or you can take 2 to 3 spoon of sugar, or you can take a glass of fruit juice or any sweet thing which can readily give you a carbohydrate, like toffees or chocolates or glucose tablets. So if you consume 15 gram of oral simple carbohydrate, then your sugar will bounce back to normal levels. And once you consume 15 gram of oral carbohydrate, you should recheck the sugar after 10 or 15 minutes, and if it is less than 80, then you should repeat the 15 gram of oral carbohydrate. If for some reason you are not able to take oral carbohydrate immediately on onset of hypoglycemic symptom, then you may develop a severe hypoglycemia, and in severe hypoglycemia you may become drowsy, or you may also lose consciousness. So it is very important, if a person develops severe hypoglycemia and goes unconscious, then he or she should be hospitalized and given intravenous glucose immediately. So by giving intravenous glucose immediately, you will regain the consciousness again, and then appropriate adjustment of your oral medicine or insulin dosages is required, which you can do easily by consulting your respected doctor. Best wishes on occasion of World Diabetes Day, and I wish you a healthy and a long life. Thank you.